We've got some questions today that really go to the heart of the matter of so many important things. And this one is from Jay in Brooklyn, and he obviously is really concerned. He says, we can't get someone on the phone for Medicaid. I have no health insurance. I can't be seen for treatment. This is not right, he says. Jay, you're absolutely correct. That's not the way I want to see anything go for a New Yorker who needs health care. So your city's here to help you. Jay, you can enroll, any New Yorker can enroll in Medicaid. If you qualify, we'll sign you up. If you don't qualify for insurance, we still have ways to make sure that you get treatment. And there are many options for those who do qualify for insurance. Some are low cost, and there's ways to get treatment for no cost at all. So what do? You call 311. You can go on to the website for New York City, nyc.gov. Look up all the things that we're offering. The NYC Care Program, for example, is something that's now building out to help people. The Get Covered NYC campaign to make sure that folks can find an insurance that works for them. So if you need an appointment urgently, if you're in a situation where you need urgent medical care, even if you don't have insurance, our public hospitals will take care of you, and you can call 311 and find that public hospital near you through Health in the Hospitals. Any way you slice it, if you're not able to pay and you need help, we'll be there for you regardless of your ability to pay. Now, this question comes from Dira, and Dira says, you mentioned enrichment centers that they're open to assist the children of essential workers. And Dira says, look, I have 2 kids who are not of age to attend these centers. What other option do I have in this case? And look, Dira, the answer is for all essential workers, there are options for you. When we put these centers in place, it was to make sure that all our healthcare workers, our first responders, and so many other essential workers would have a place for their kids so they should go and do the important work for all of us and be safe and secure. Look, it doesn't matter what the age of your child is, we got you covered. So these enrichment centers start at 6 weeks old and go all the way up through the 12th grade. We have regional enrichment centers, pre-K centers, emergency child care centers, and family care centers as well. Something for everyone, every kind of essential worker, whatever you need for your child. Go to schools.nyc.gov and you can enroll right there. And the Department of Education will reach out to you within 48 hours to figure out a placement that works for you. Finally, we have a question from Felix from Manhattan, and Felix says, now that we have to wear masks, there's already been a run on the good ones. He says, since we're not supposed to wear them twice, how can we get enough? Well, Felix, I want you to not even use that word mask, because when you think about the masks, those high caliber masks that our first responders need, our healthcare workers need, that's a particular kind of item that's really meant for them, for the folks who are on the front line saving lives. For everyday New Yorkers, what you need is a face covering. And this is going to help protect everyone. Just putting on that face covering each day, it's a rule, it's the right thing to do, and it also protects the whole community. All you need, it could be a bandana, it could be a scarf, something you make at home. It does not need to be one of those really specialized masks that the healthcare workers use. Look, whatever way you want to express yourself, be creative, but the important thing is when you go outside, just make sure your mouth and nose are covered in some way, and that will do the trick. Everyone, thanks so much for your questions. Keep sending them in, and I'll keep giving you answers.